For a medical perspective on this case, we go to Dr. John Bruchalski, founder of Tepeyac OBGYN, a pro-life, faith-based medical practice, and Divine Mercy Care. He is also a former abortionist. Dr. Bruchalski, great to have you on today. Explain to us what an emergency abortion is and in what type of situation would a woman need one, if at all?
Well, the word abortion is very loaded, Tracy. Elective abortion is never necessary to treat a disease. There are times that in treating the disease, such as hemorrhage, when the mother is only a few weeks pregnant, or an infection where you must treat the underlying infection in the womb, that sadly, there is a secondary effect that you separate mom from her unborn child, not directly like an elective abortion. Remember, this is abortion on demand. This is that they're saying elective abortion is health care. We've been practicing excellent, life-affirming, Hippocratic medicine for millennia. And for the last 30 years, I've had to work under EMTALA laws, and you never have to provide an elective abortion. There are times, such as an ectopic pregnancy, in those several few cases where there's a heartbeat, we target the disease, never the patient with the disease. We take out a section of the tube. We target disease. That is excellent medicine. And we always care for two patients. So the emergency abortion that they're dreaming up is bypassing the reality that excellent medicine never needs an elective abortion. And we always target the disease as we care for two patients, never pitting mom against her unborn child.
Dr. Bruchalski, I mean, how do you think this is all affecting doctors and medical care providers, especially when it comes to conscious rights?
Well, you know, Tracy, you put your finger on the pulse, but that's not what that's part of what we're talking about here. So many of us over 50 years of Roe have always had abortion as a backstop, except for those of us out here who have practiced life-affirming medicine. Abortion was never an option, even though at one point I thought it was good and necessary and healthy. Realizing that excellent medicine, the maternal-fetal medicine revolution, the perinatal revolution, where we care for both patients simultaneously, that provides excellent medicine. So what they're talking about in that little clip you ran was about being sued. We don't know what the law is. Wait a second. Excellent physicians know that abortion is morally bankrupt. It's morally wrong. That's why only 7 to 14% of all OBGYNs do them. If it was so good, why don't more of us do it? Because it's brutal, and it's violent, and it's treating our second patient like a sexually transmitted disease, which they're not. And so it is going to impact. If the United States of the Biden power structure says you must trump watching and waiting, treating the disease, serial exams, stabilizing the woman. Abortion doesn't stabilize the unborn child. It doesn't stabilize the mother. In fact, it just puts a Band-Aid on what needs to be good medicine. When I was a resident, I had a case like this in which we did not stabilize the mother. We aborted the infant, and in the process of aborting that infant, the mother died. Because remember, abortion makes you take shortcuts, and excellent health care today, we are all demanding, take us seriously, get us to go to the roots. Never pit mom against baby.
Absolutely.
And so, yeah, it will hurt much of our conscience rights. So, yes, I hope this does not pass.
Yeah. And Dr. Bruchalski, thank you so much for coming on. Always a pleasure to speak to you. And thank you so much for your insights. God bless you.
God bless you, Tracy.